South Louisiana. Right now, look, we're in South Louisiana. Anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting.
So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
Good day, my friends. Welcome to a little evening edition of Tea with Dr. D. I wanted to change this up and see if I could chat with y'all this afternoon and kind of catch a little evening, a little bit of time with you. So if you have any questions, any thoughts, anything that we can go through and help you out in terms of health, healing, anything that we can do, that's what we do here on Tea with Dr. D. So I hope y'all are doing well today. My tea, I'm actually drinking. This is kind of one of my go-tos in the afternoon. So coffee fruit tea is a kind of extract where it's like the bean that the coffee comes in, and they take that and it's got good like antioxidant properties and quite good health properties and low in caffeine. So great for like an afternoon or evening. So I always mix up my afternoon tea with that. So that's where we're going. And I thought I'd kick this off with a conversation that I just had with one of my patients. She was telling me that her husband started doing like infrared and PEMF. So if you're not familiar with that, pulse electromagnetic field therapy is something that communicates with your cells. You lay on this mat that creates a field around your body that improves cell communication, that improves blood flow throughout your body. And that helps a lot with reducing our nervous system stress. So a lot of us live in kind of this fight or flight all the time, and we're always kind of in this like stress state. And when we get on PEMF and we get on one of these pulse electromagnetic field mats, it reduces the stress that our cells are having to function under. So what she was saying was when her husband started doing this, his anxiety and his stress and his kind of irritability and really like overall mental well-being has improved dramatically. And so she was like, look, he's going to keep doing it whether he likes it or not. But it does kind of show you how much today we're all in this kind of sympathetic overdrive. We're all in this fight or flight all the time. And if we can have those things in our day, in our week, that help us reduce stress, that help to calm our nervous system, it really does help a lot with mental health, but it also helps a lot with healing because our brain and our body don't know how to separate physical stress from mental stress. Those two affect our body very much the same way. So whether we're worried about a conversation, or we think we're stressed out about food, or we think we're stressed out about running from a lion, our brain and our body treats all of those things the same. So, that's something that we're always trying to improve is, can we improve how our body handles stress? And can we have some things in our daily life, in our weekly life, that help lower that anxiety level from a chemical standpoint inside the body? And that can be really, really powerful, whether that is doing something like sauna, doing cryotherapy, or in this case, doing like a PEMF and infrared combination session. So I thought it was a really cool story. She said it's just dramatically changed his life, his stress, his healing has greatly improved. So if you have any questions, welcome to Tea with Dr. D. Please let me know if any questions jump out. And if you have anything on thoughts on healing, on pain, we'll dive into it. I know we got a couple questions that we're going to jump into that a few of you sent. You can text us if you have any questions, and we'll dive into them on here. So here's what we got. Amy and I remember reading this. I was like, I definitely want to dive into this because I've talked a lot about shoulder health. So when we're looking at something like this, a slap tear is a labral tear at the top of your shoulder. And it's one of those areas that I think a lot of people will talk about needing surgery. So, I've heard that I can heal something like that without pain, without surgery. What would you recommend? What compounds? And we've gotten a lot of questions. This is why I wanted to dive into this in terms of BPC 157. So let's explain this a little bit. So when we're looking at the shoulder, your labrum is what kind of creates the capsule around your shoulder there. And so when we look at something like that, it really is what keeps our shoulder in the socket, so to speak. So it's very important. If we don't have a good intact labrum, your shoulder will start to feel very loose in there and start to kind of slide around and almost, slide out of socket at times. And so when we look at this, we're trying to strengthen that labral attachment around the shoulder. So that's what the labrum is and does. Let's talk a little bit about BPC 157. So BPC 157 is a peptide that is often originally found in stomach acids. It's found in your stomach. And what it's used for in general is to repair stomach lining. When we have it in enough capacity, it goes outside of the stomach, goes into the cells. And what we see on research is that it attaches to the receptors that are responsible for growth hormone and growth factors. So that's how we think it helps to aid in tissue regeneration. We're still digging into that, but what we do know through animal models is that BPC 157 does a really good job of helping the body repair tissue, helping the body to regrow healthy tissue and increase growth factors in those tissues. That is really important because when we're trying to regrow something like a slap, a labrum, that's not a very vascular tissue. Your labrum is a very high collagen tissue. And when we're trying to regrow that, it's a difficult thing to do. We need to make sure that we're getting blood flow to it. We need to make sure we're getting regenerative compounds to it. So I have seen many slap tears repair completely without doing surgery. There's a limit to that, of course, and like how much could your body potentially repair. What we see that works really well is if you're using a compound like BPC 157, if we're directing that compound. So we would do something like needle into the labral area where the damage is at, so that we're activating a healing process so your body knows where to send the peptides to actually create the regenerative process. Now that takes some energy. So a lot of times we would want to combine that. We do high intensity laser therapy. This is a multimodal approach to healing the labrum. That high intensity laser gives those cells lots and lots of energy so that they can actually rebuild some healthy tissue. A couple of caveats. BPC 157 has gone nuts. It's everywhere. And even you hearing me say this now, you'll probably start getting ads for it. Be very careful where you get peptides. You really want to make sure that you're getting peptides from a very reputable place. We have a company that we work with that makes a really good peptide. It's very well studied. I haven't seen any negative reactions from it. I've had a few patients who bought peptides online that were kind of for experimental purposes and had bad reactions to them. That's almost always due to a tainted compound, a tainted peptide. So just be careful where you're finding those things. Ideally, you would work with a practitioner who's helping you get those. I know it looks enticing to see a peptide online for like half the price of what your doctor might be telling you. There's a reason that it's that cheap, and I've seen negative reactions to some of those. So that's my little kind of spill on that. This could be a great treatment to start the healing process. And then what we need to do is we need to gently start to strengthen the labral attachments. And that's basically doing stability work in your shoulder. So a lot of times we'll start doing that very easily, where we're just starting to do like planks and things like that, where you're loading the shoulder to create more stability in the shoulder joint. I'll say this here. I don't know where, Amy, where you're asking this from. find somebody really good to work with. Find a great therapist, find a great doctor who can help you go through the initial stages of this. I'm not saying there's not a point on the end where you can do a lot of this on your own, but that's not something, especially a SLAP, if you're going to really heal it, that's not something you want to go at on your own. You really want to make sure that you're working with somebody very good who's giving you mechanics, who's trying to address the reason you had the injury in the first place, and somebody who's really going to be helping the healing process improve and go in the right direction and tell you when things are kind of getting off. That's really tough to do because if you're healing a SLAP tear, you're going to have times where it still is feeling bad because you're stressing the tissue. You need to know that, nope, I'm on the right path. That tear is healing. I'm taking the right things. I'm getting the right treatment. I'm getting all of the correct things into my body so that I can repair that. When we're doing stuff like this, increase, like all the small things matter when you're trying to heal tissue like this. Increase protein intake, make sure you're eating really clean, make sure you're staying hydrated so that blood flow is getting in and out of these deeper tissues. All those things do really well to help kind of increase your ability to heal these things. So yes, but I would work with somebody who is local, who has worked with SLAP tears before, and really make sure you're kind of getting a multimodal approach. I never recommend somebody to just take a peptide so that they can heal. The same thing I don't find very often that just taking, a single medication to heal pain or a physical problem ever works. You need to do like a multifactorial treatment approach to get this stuff better. So hopefully that helps. You can heal it, but I would bring in more than just try and take the peptide and do the exercises on your own. You're going to need more to really heal a complex SLAP tear. So hope that helps, Amy. Let me know if you have any questions about that. Hope y'all are doing well out there. Drop me a little line, say hi if you're joining us. If you have any questions, let me know. I appreciate y'all jumping on with me this evening on Tea with Dr. D, getting my little coffee fruit tea in. This goes without saying. I'm going to spare y'all my soapbox a little bit. I get this question a lot, specifically from online communities where like somebody is like, I can YouTube these things. I can see the exercise. Do I need to go and pay for treatment? And look, when we hear these things, I think one, if you feel like you're getting care that you can do on your own, then find other care, find somebody else to work with. That's never what we want somebody to feel like. The other thing is there's so much conflicting information. I just had this conversation with one of my patients today. It's like, I'm looking up exercises to do for elbow pain. And one guy says, do these, they're great. And another guy says, no, don't do those, they're terrible. One guy says, all you have to do is load it. Another guy says, all you have to do is stretch it. And he's like, look, I'm getting pulled in all these directions. I don't know which ones to actually do. And one of the things that I was telling him is like, all those answers are yes, they could be good depending on where you're at in the healing cycle. So that's a big part of it, is like you could be doing the right thing at the wrong time. And if that's the case, you're going to still have a negative outcome. You could do the right stretch or the right exercise at the wrong time, and it's still going to be painful or not get you to where you want to go. So I think, yes, there should be some things that you are doing on your own to get better. But you really want to make sure that you know where you're at in the healing process. You know what you need to do in that healing process to get to the next level. And like what your job is and what the practitioner's job is. I think all those things should be the case anytime you're getting care, whether that's from a physical therapist, an osteopath, a physician, a chiropractor, any of those things. That should be the case in any treatment where you're collaborating on these things. So I think it's going to be much different if you go and get great care and they're working on and activating and doing things to turn on muscles and turn off muscles and working on the nerves, making sure the joints are moving well, making sure that the muscles attached to those joints are functioning well, that the fascia on those muscles is moving how it's supposed to, and the nerves communicating to and from all that to your brain is functioning well. That's the stuff that really gets us over the hump and is much more than kind of just doing exercises. So I think that is my answer to this. Get great care so that you feel like it's worth it. If you get really good treatment, I promise it's worth whatever you pay in it to prevent further injuries, to get you feeling better faster, to get you healed deeper than you would have otherwise. It is worth whatever time and money that you put into it. We only get one body. We only get our health to the degree that we can put into it. So it's really important. You know, they have the little saying, it's like, you know, a healthy person has 1,000 wishes. An unhealthy person only has one. And I think that is really valuable to kind of remind ourselves that, you know, it is a blessing for us to feel good. And if we have these little warning signs our bodies are telling us are causing problems or potentially could cause problems, that we should take the steps to improve. We should take the steps to get healthy, because you can only put up with it so long. So I'll spare y'all the rest of my soapbox on that. Obviously, I can talk about that all day, but yes, you do need to find good care. And if you feel like I can just go and do the exercise, I'm being shown exercises, sat in a corner and like going through the motions, and I get checked on once every 20 minutes while I'm at, whether it's physical therapy or any other type of treatment, go somewhere else is my answer to that. So hope that helps, Frank. I hope that helps. What else we got? If y'all have any questions, let me know. Drop us a comment. I love this. So we're staying on the regenerative therapy bandwagon. RZSLP asked, what's up, man? I have a question. Thanks. I tore all 4 ligaments in my knee plus meniscus tear. Is it possible to come back after ligament? Okay, I was about to say, yep, you're not going to regenerate those. After ligament reconstruction, I work outside in construction. Yeah, so obviously, depending on this, if you've got, and this goes for anybody who's listening to this, if you've got ligament tears and it's a full thickness tear, the ligament's completely torn, we need to go in and have a procedure done for that most of the time. If we still have some components that are attached there, we can regenerate some portion of a healthy ligament. So if we're coming in after a surgery, we have meniscus injury and we're repairing the ligaments, that would be, all 4 would be a really bad knee injury where we have the ACL, the PCL, and then the collateral ligaments, MCL and LCL. If all 4 of those were torn, you did a really good job on this. But if you get that stuff repaired, and let's go through that, a lot of what we want to do is make sure that we're guiding the healing process really well. So in those situations, you need to really kind of do as much as you possibly can to heal this well. I talk about it all the time. I'm sure y'all get tired of hearing it. Doing the small things works. So in these situations, you need to pay a lot of attention to nutrition, to sleep, to movement, to diet, to supplementation, to stress. All of those things matter if your body has to undertake this massive healing approach. So when we're talking about regenerating healthy tissue, we still go through the same complex if we're coming off of a surgery as we do if we're trying to avoid a surgery. So if we're coming off of a surgery, I find a lot of times that, yes, bringing in like a collagen peptide works. Bringing in a peptide like BPC 157 really helps speed the healing process and the regeneration of those healthy attachments of the repaired ligament. So we put all of that stuff in. Things for knees that I think get missed are, we need to make sure we're regaining a crazy amount of stability in the knee to strengthen the knee to the degree that it was stronger and more stable than before the injury. You can do a lot. Y'all have probably seen or heard me talk about the footboard. A footboard is a little wobble board your foot stands on. This makes your knee kind of shake, and you really have to work hard to stabilize yourself. All of our knee patients get on that at some point in their recovery to start to regain that stability in their knee. Once you're really moving and you're starting to probably 6 to 8 weeks out of surgery, we want to make sure we're increasing walking. We want to make sure we're increasing extension. So you'll do a terminal knee extension. So you're standing and just really driving your knee all the way straight and just creating there's a rod through your leg, and you're just tightening everything as much as you can to hold that knee straight. If we see anything after ligament surgeries, it's usually something called an extensor lag, where you can't straighten your knee all the way, and that creates a problem. Down the road, that creates a lack of knee stability, and that can really kind of cause some issues. If you're going to be doing very high level work, then you need to make sure that you're doing high level training to get to that work. So we need to make sure we're doing balance training and you're doing full range of motion. Again, this is at the right time in the healing process, but full range of motion, knee strengthening. So we're strengthening at the very bottom of the knee range of motion, all the way bent, and we're also strengthening all the way at that last 20 degrees of straightening, and everything in between. We need to make sure that your program is going to allow you to squat and twist. So train for those things. We get a lot of people on these balance boards as well. So stability becomes your major job. Get on a footboard, increase your foot strength and stability. Get on a balance board where the little roller is kind of trying to roll out. Y'all have probably seen me talk about or do that on social media at some point. In those situations, we're working the lateral stability of the knee, and you're having to use your hip, all the muscles in your knee, all the muscles in your foot to create that. Those are really good things that you can do on that. Another thing that I'll throw in there that's just like a little tip, if you haven't tried blood flow modification therapy, that would be on my list for something like this. Katsu, if you Google Katsu, that will be something that you can use. It creates a little tiny blood flow modification. You'd put it on your hip. It slightly slows the blood flow to all the muscles in your legs. So you get a 300% increase in growth hormone for doing very light work. So all those little balance exercises, we would do it with a blood flow modification band on you. And you can go listen to my podcast with Stephen Muñatonis about Katsu therapy. Amazing therapy, especially if you're coming off of a major injury like this. It's a really, really good thing that I would add in there, and just keep going. You're probably going to be looking at 12 to 18 months of good strength and stability training to get to where you feel like your knee is healthy again, but it will get there. Make sure you're working with a great doctor, a great team, a great physical therapist, and you'll really, in a better place and really be able to use it. But hopefully that helps. I would do all the things that you can to increase the health of the tissue. And that is taking all the right things, keeping inflammation down, and then really start to kind of increase the stability that you can in the knee, in the hip, in the foot and ankle, and you'll do really well with it. So I hope that helps, and that you have a great process to get that better. Sorry to hear that, man. I know that's a big injury and a big surgery. So I think when we're looking at a lot of these things, one of the things I want y'all to kind of understand is like that almost all injuries can get better to some degree if we're doing the right stuff. And that's a big part of what we try and explain to patients is, if you haven't gotten better from an injury or from a pain problem in the past, most of that is because either you haven't gotten the right treatment or you haven't gotten the right diagnosis. You're not treating the right tissue. And every time I have a patient who's like, I got this injected and it didn't work, most of the time that's not your pain generating tissue. So we really want to work to find that, and then we can really take off with treatment. And so I'm not saying that there's one specific therapy. I don't believe in a magic bullet. I think when we're treating pain and we're treating complex issues, everything is wrapped into that. You have kind of the nerve function, blood flow, the vascular function, the muscle function, the joints. You have the fascial coverings around that. You have the functional activity, and then the beliefs about what we can do with that. All of those things interrelate to get to how much better can we get. So we need to address all of those factors. whenever we are looking at getting better and getting good recovery and getting over some sort of a pain problem. You can get to the point where you're going to feel a lot better. Just keep going, keep searching, keep believing it can get better, because I'm telling you, I've seen every crazy injury get better. I've seen nerve issues, brain issues. All of these things can improve if you just keep going and keep trying to get a little bit healthier in one area or another each day. Just try and get a little bit better. And when you do that, those things start to stack and they start compounding, and they really feed into a lot of areas of your health and your recovery. So you can get better. I promise it can. Get good care. Keep looking, keep trying things, and keep getting a little bit healthier every day. And you can heal some pretty deep, complex issues. So I hope that helps some of you out there. If you have questions, please shoot me a text. I am the one that answers that, 801-691-7582. And we'll answer whatever questions you have. We may throw it on next month's tea. And if you have anything else that you need, don't hesitate to reach out to me or my team. They are the best at what they do. So I hope y'all have a great evening. Thanks for joining. Thanks for the questions. Thanks for the feedback, everybody. Have a good night.